Hey everyone! Today, we're diving into the lesser-known side effects of GLP-1 drugs like Ozempic, Mounjaro, Wegovy, and Zepbound. These drugs are popular for weight loss and managing type 2 diabetes, but there's more to the story than what's on the label. So, let's explore some of the hidden side effects that clinical trials might have missed. Music plays. First up, let's talk about menstrual changes and the Ozempic baby phenomenon. A study analyzing over 400,000 Reddit posts found that 3.8% of users reported reproductive symptoms, including intermenstrual bleeding, heavy bleeding, irregular menstruation, menstrual disorder, and painful periods. This is concerning because it suggests that GLP-1 drugs can disrupt the menstrual cycle, and it's especially relevant for women with polycystic ovary syndrome, PCOS. Interestingly, these drugs can actually help restore fertility in women with PCOS, but it's a double-edged sword. On one hand, it can lead to the Ozempic baby phenomenon, where women who were previously infertile suddenly ovulate. On the other hand, it's not recommended during pregnancy due to potential fetal harm, and women of reproductive age should use backup contraceptives when starting treatment. Next, we have taste and smell changes. Reddit users reported altered taste sensations, with 1.4% describing a metallic taste and 0.6% experiencing a broader taste disorder. This is because GLP-1 drugs physically change the tongue's taste sensitivity and how taste genes work. They also shift the brain's reaction to sweets, which can lead to a blunted pleasure response from eating high-fat and sugary treats. And let's not forget about sulfur burps, which are caused by slowed gastric emptying, allowing food to ferment and produce hydrogen sulfide. To manage these issues, consider limiting sulfur-rich and high-fat foods, eating smaller meals more frequently, avoiding carbonation, and using simethicone or bismuth subsalicylate under medical supervision. Moving on, we have temperature disruptions, including chills and hot flashes. These symptoms were reported by 1 to 4% of users, and there's a biological rationale for this. GLP-1 receptors in the hypothalamus, the brain's thermostat, can directly force the body to burn fat for heat. This can lead to sudden shivering fits or abrupt flushing and heat. To help with this, clinicians recommend slower dose escalation and adequate caloric and fluid intake. Persistent chills may also indicate iron, B12, or thyroid deficiencies, so a medical workup is necessary. Another side effect is hair loss, which was reported by 3.1% of Reddit users. Rapid weight loss can push hair follicles into a resting phase, leading to shedding around 3 months after the weight loss starts. This is often self-limited and resolves within 6 to 9 months once weight stabilizes. Adequate protein intake and iron, zinc, and vitamin D are crucial to prevent hair loss. Lastly, we have structural volume loss in the face and genital area, often referred to as Ozempic face and Ozempic vulva. A study found a 9% loss of mid-face volume in GLP-1 users, and this can occur in other areas as well. To reduce the risk, pace your weight loss, maintain protein intake, and consider resistance training. Dermatologists can also offer fillers, injectables, and energy-based tightening for facial volume. In conclusion, while GLP-1 drugs have been a game-changer for obesity and type 2 diabetes, it's essential to be aware of these hidden side effects. Clinical trials might not capture every symptom, and patients should be better informed about potential risks. Many of these effects are manageable, and several respond to interventions like slower titration, adequate protein intake, hydration, resistance training, and a prescriber who listens to symptoms not listed on the label. So, always consult with your doctor and be aware of these potential side effects. Thanks for watching, and don't forget to like and subscribe for more insightful content. Music fades out.